Persistent or recurring chest pains can be a sign of the narrowing of the coronary blood vessels. This means that part of the heart muscle is not receiving an adequate supply of blood. When the relevant vessels constrict completely, a heart attack occurs. If a heart attack is suspected, an echocardiogram is generally carried out. This provides information on the type and severity of the potential heart attack. Where the risk of myocardial infarction is high or a heart attack is suspected, there are various possible treatment strategies in hospital. One is what is known as the direct invasive treatment strategy, in which all patients generally receive a heart catheter examination. Here, a thin tube is pushed through an artery in the groin, the crook of the arm, or in the wrist to the left ventricle, and contrast dye is injected. It is then possible to detect potential constrictions using images of the distributed contrast dye. If a constriction is found, the vessel can be expanded using a balloon at the tip of the catheter to improve the supply of blood to the heart muscle. A metal artery support, a stent, can also be used so that the blood vessel stays open. If it is not possible to fix the constriction in this way, open heart bypass surgery would be needed. Here, the narrowed vessel is bypassed by an artificial vessel. The initial medication-based treatment strategy involves waiting and giving medication with the goal of improving specific blood levels and other vital signs in order to reduce the risk of complications in a later procedure. A heart catheter examination is only carried out and a stent or bypass used in a second step if this is unsuccessful and patients continue to experience chest pains, or a follow-up examination shows that the vessels have become even more restricted. Opinions differ widely as to whether direct invasive treatment should be performed immediately or whether medicinal therapy should be pursued first. And that's reason enough for us to look into the matter. HealthSada is committed to health and encourages personal responsibility and health literacy. We take a close look at complex health issues and reveal the facts. The Harding Center for Risk Literacy has summarized the potential benefits and risks of the treatment strategies in the event of a heart attack or high risk of a heart attack based on scientific studies. In an initially medication-based treatment strategy, around 13 in 100 people have a heart attack within 5 years. With the direct invasive treatment strategy, around 9 in 100 people have a heart attack, for example, during the procedure. 29 in 100 people who initially receive a medication-based treatment strategy have to go back into hospital within a year. This figure is 22 in 100 for people who receive a direct invasive treatment strategy. If people were initially treated with medication, 1 in 2 people do not have to have an operation on the heart blood vessels within 5 years. Heart surgery always involves a risk of complications. Ultimately, everyone must decide for themselves, after consulting a cardiologist, whether a direct invasive method or medicinal therapy is the right option. We hope you now have a clearer overview of this complex issue.